class. So now we're going to do the venipuncture technique and phlebotomy techniques doing the routine ETS. ETS is evacuated tube system venipuncture. Most venipunctures are routine and can be performed on antecubital veins using an ETS system. This system is preferred because it is direct, efficient, relatively safe for the patient and the blood draw, and allows multiple tubes to be easily collected. So the equipment that we will need be the tourniquet, alcohol prep pads, we have the tube holder and the needle assembly. We have the tubes. So we have the light blue, the red, the green, the lavender, and the gray. We have cotton balls. We have the adhesive bandage. We have the gloves. And we have the 2-gallon infectious waste container. Procedure: wash hands thoroughly before beginning any phlebotomy procedure. Confirm the identity of the patient. This can be done by asking the patient's name or requesting to see the patient's identification card. In other words, class, any form of picture ID. Explain the procedure, including small risk of hematoma, slight pain, and some lightheadedness. Inquire whether the patient has a history of fainting or dizziness with phlebotomy procedures so that ammonia inhalants can be obtained. Explain the loss of vacuum or collapse. Collapsed vein might necessitate another draw. Position patients so that they are seated comfortably in a chair with arm extended on armrest or desk or table to form a straight line from the shoulder to the wrist. Arm and elbow should be firmly supported and not bent at the elbow. On a table or desk, assemble all necessary equipment: cotton balls, tubes, needle, alcohol swab, tourniquet, gloves, and plasters. Wearing latest gloves is mandatory. Wear additional protective equipment if contamination is expected. Check both arms to select the larger and fuller veins. Palpate and trace the path of the vein several times with your index finger. Tap the vein at the side of the drawer with your index finger and second finger. This will cause the vein to dilate. The following factors should be considered in site selection: extensive scarring, healed burn areas should be avoided. Hematoma, specimen collected from an area of hematoma may yield erroneous test results. If another vein site is not available, the specimen should be collected distal to the hematoma. Specimen collection. Ask patient to open and close his or her fist so veins will become prominent. Vigorous hand pumping is not necessary to activate blood flow and should be avoided. Clean the venipuncture site with the alcohol swab in a circular motion from the center of the area to the outside. Allow the area to air dry to prevent hemolysis and burning sensation to the patient. Insert the needle into the vein bevel up. There is confirmation of success when a small amount of blood appears in the back of the needle. This is often referred to as flash. Once the blood has been obtained, remove the needle. Place cotton ball or 2x2 square over the site. Apply pressure for 2 to 5 minutes. Place a band-aid over the puncture site in case of any further bleeding. The blood is usually transferred quickly. In the case of the ETS, the tubes are just changed. You do it in an order, which I will explain, order of draw. And all you need to do is, once you are in the vein, you just change the different tubes that you will be needing to do the test for the patient. Wash hands thoroughly after phlebotomy. So class, we're going to do procedure in Chapter 8, routine ETS, evacuated tube system, venipuncture. So step 1, review and accession test requests. Step 2, approach, identify, and prepare patient. Step 3, verify diet restrictions and latex sensitivity. Step 4, sanitize hands. Step 5, position patient, apply tourniquet and ask patient to make a fist. Step 6, select vein, release tourniquet, ask patient to open fist. Step 7, clean and air dry site. Step 8, prepare equipment and put on gloves. Step 9, reapply tourniquet, uncap and inspect needle. Step 10, ask patient to remake a fist, anchor vein and insert needle. Step 11, establish blood flow, release tourniquet, ask patient to open fist. Step 12, fill, remove and mix tubes in order of draw. Step 13, place gauze, remove needle, activate safety feature and apply pressure. Step 14, discard collection unit. Step 15, label tubes. Step 16, observe special handling instructions. Step 17, check patient's arm and apply bandage. Step 18, dispose of used and contaminated materials. Step 19, thank patient, remove gloves and sanitize hands. And the last step, transport specimen to the lab.
Well, okay, I've ordered. Yeah, that got good. Got to force it.
Class, we have the troubleshooting guidelines. So guideline number 1, if an incomplete collection or no blood is obtained, change the position of the needle, move it forward, it may not be in the lumen, or move it backward, it may have penetrated too far, adjust the angle, the bevel may be against the vein wall, loosen the tourniquet, it may be obstructing blood flow, try another tube, there may be no vacuum in one being used. Re-anchor the vein. Veins sometimes roll away from the point of the needle and the puncture site. Troubleshooting guidelines number 2, if blood stops flowing into the tube, the vein may have collapsed, resecure the tourniquet to increase venous filling. If this is not successful, remove the needle, take care of the puncture site and redraw. The needle may have pulled out of the vein when switching tubes. Hold equipment firmly and place fingers against patient's arm using the flange for leverage when withdrawing and inserting the tubes. Troubleshooting guide number 3, problems other than an incomplete collection. A hematoma forms under the skin adjacent to the puncture site. Release the tourniquet immediately and withdraw the needle. Apply firm pressure. Hematoma formation is a problem in older patients. The blood is bright red. So in this case, that is an arterial puncture rather than a venous puncture. Apply pressure for more than 5 minutes.